Well, let's talk now to Dr. Mark Honigsbaum, who's a specialist in the history of infectious diseases. Just give us some kind of idea of to how this outbreak compares to the others from the past that you have studied.
Okay, so I mean, the closest comparison is probably with swine flu in 2009. So if you remember, that emerged in slightly later in the season, in April, in Mexico, but it very rapidly spread worldwide. So within 2 and 3 months, it was a global pandemic. And it seemed to affect the elderly segments of the population or people with underlying health conditions more than, young people or people who are, basically healthy.
And you use the P word, pandemic, which everyone seems to be debating over the last few weeks. Is this a pandemic? And why is there such a debate over using that word in this instance?
Well, I mean, it most certainly meets the most basic definition of a pandemic. The World Health Organization says a pandemic is simply a worldwide outbreak of a new disease. So we already have that. But of course, there are more technical definitions, and this is really where the term pandemic becomes political. And I think part of the reluctance to use that terminology is because, of course, pandemic contains the suggestion of panic. Right? So if you take 5 letters out of the middle, you get the word panic.
All of which leads obviously on to another question, which is what do you think of the authorities' responses around the world in comparison to previous outbreaks?
Well, I think we've learned a lot from previous outbreaks, and I think we should be very grateful actually to the Chinese because they were able to take draconian quarantine measures. They seem to have slowed the spread and bought the rest of the world some time. But we're now seeing that you just can't keep out a respiratory virus forever. So I think that we're now going to see every country's health system being tested, and we're going to discover where the weak links in the chain are.
Okay, in your view, has the World Health Organization and national health authorities learned from the past?
Yes, most certainly. I think we've got much better at sharing scientific information, and that's really important because we're now involved really in a race to develop a vaccine. Okay, and that can only happen when scientists all collaborate together and don't wait months to publish their research. So that is happening now. But even with that, it's very unlikely we're going to have a vaccine before the end of the year. And most experts think that this outbreak is going to continue for at least another 2 months. Probably will only end when the warmer weather comes in the summer.
I hope you'll come back and talk to us again in a couple of months and we'll further assess this. But for the moment, Dr. Mark Honigsbaum, thank you very much.
Thank you for having me.